Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. And today, we're going to talk about hot tubs and saunas in pregnancy. Now, hot temperatures, excessive temperatures, especially in the first trimester, can be potentially dangerous in pregnancy. So a fever, for example, can cause birth defects or miscarriage. So if you get the flu in pregnancy early on in the first trimester, and you have a high fever from whatever illness, especially above 100.2, then that can lead to a miscarriage or birth defects. And there is some suggestion, though harder to definitively prove, that exposure, hot tubs or saunas, could increase those risks as well. So I would definitely discourage that in the first trimester. But certainly the comfort of a hot tub, I'm really not a big fan of a sauna, but the comfort of a hot tub, the massaging, a jacuzzi could potentially be helpful for the discomfort during pregnancy. So you need to be careful as you progress in pregnancy to avoid high temperatures. Also, you have a substantially higher drowning risk or injury risk when you're pregnant. So I would never do that alone, not for more than 10 to 15 minutes, and make sure you've had something to eat or drink. When you get excessively hot, you can get dizzy and pass out. When you're not pregnant, when you're pregnant, that can happen much more commonly. So you don't want to do it alone, and you want to keep it for a small amount of periods. Watch for the dizziness. We don't want you to get a fall. An injury can be really problematic in pregnancy, and you can't take Advil, ibuprofen for the discomfort, even if you just twist your ankle. But if you fall and hit your belly, that could be a certain risk to the baby. We don't want you are at a little higher risk for drowning, so I wouldn't do that alone at home in your own bathtub where it's excessively hot for a long period of time. That being said, for a brief amount of time with someone with you, not too hot a temperature, the massaging jets might give you some of that back relief that you desire. So you might find a place for it. Knowing some of those precautions, and check with your physician. You might have additional risks that would suggest you should avoid it. Also, if you're not sure of the conditions of the water, like you're at a hotel or something, then sometimes they can use a little excess chemicals or not enough. That can lead to infections or irritation. So it might be something to avoid if you're not sure about those conditions. So I won't say absolutely no, but you need to discuss it with your physician. There might be a small place for it, knowing those restrictions of lower temperature, not too long, having someone available. Be careful about the high temperature exposure, especially in the first trimester, and then also the fluid exposure in the end of pregnancy. And then you might find a small place for that. Hope you found these comments helpful. Please leave your notes. Thank you.